a sanitation directive on this matter, especially across our borders. Especially across our borders. The people are agitated about this matter. Can you, the minority, we've allowed you to ask all your supplementary questions.
But
allow the speaker to rule on this matter.
Majority Chief Whip.
Mr. Speaker.
You've heard the indication.
Mr. Speaker, the indication is not your indication.
The question is not about policy. You are talking about policy. Honourable members, let's move to question number B. Urgent question number B. Standing in the name of Professor Kinsley Nyako, Member of Parliament for Kwadaso, and my very good friend.
No, we are more than friends, brothers.
You have the floor.
With occasional fights. The Speaker, thanks for indulging me. Mr. Speaker, thanks for the opportunity to ask the Minister for Health the measures the Ministry is putting in place to expedite the treatment and recovery of Ms. Sandra Bafi-Boateng, who was seriously injured and fell unconscious during the Ghana Armed Forces recruitment exercise held on 12 November 2025 at the Baba Yara Sports Stadium and has been on admission at the Kwabena Teaching Hospital till now. Thank you, Mr. Speaker.
Yes, Honourable Minister.
Mr. Speaker, I thank the Honourable Member for Kwadaso for the question and wish to assure this Honourable House that the Ministry of Health has remained actively engaged in ensuring Kwabena Teaching Hospital to ensure that Ms. Sandra Bafi-Boateng received the requisite specialist care and that every necessary step is being taken to expedite her treatment and recovery. Without disclosing sensitive clinical details, Mr. Speaker, I can confirm that the patient sustained serious injuries during the Ghana Armed Forces recruitment exercise held on 12 November 2025 at Baba Yara Sports Stadium, following which she received inpatient care under specialist supervision. The measures being implemented to support her treatment and recovery include ensuring that her medical bills are fully covered by government so that no cost is passed on to the patient or her family. This has been complemented by comprehensive care delivered through a specialist-led multidisciplinary team, together with the required rehabilitation and related social support to optimize recovery. The Speaker, the patient has since 26 February 2026 been transferred to the 37 Military Hospital for further management. Government is also considering all appropriate medical options, both locally and where necessary abroad, to ensure that she receives the best available care. In addition, Mr. Speaker, the Ministry is facilitating the training and continuous capacity building of first responders to strengthen emergency response systems and improve outcomes for Ghanaians who may be affected by similar incidents. The Ministry of Health remains committed to supporting the patient's full continuum of care. We will continue to work with the relevant health facilities and, where necessary, engage other state institutions to ensure continuity of treatment, rehabilitation, and appropriate follow-up until her condition stabilizes sufficiently for discharge and subsequent outpatient management. Mr. Speaker, I so submit.
Honourable Member, any supplementary question?
Mr. Speaker, I thank the Minister for doing justice to Sandra Bafi-Boateng's situation. Mr. Speaker, I went to visit her about 2 months ago, and her condition is precarious. And I'm also happy that she has been brought to 37 Military Hospital to receive enhanced.
You see, we also always fight because you refuse to take a cue
Mr. Speaker,
from
this
Order
is-
88.7.
I
You
know.
cannot address the House. You are to ask a supplementary
This
question.
is an emotional.
Whether
something that is-
emotional or not, that will not change the rules.
So, Mr. Speaker, with the response that you are considering the option of sending her abroad, will you expedite that option? Will you consider expediting that option of sending her abroad for enhanced medical care? Thank you.
Mr. Speaker, we will be taking signals from the specialists. So as and when necessary, we will do accordingly.
Yes.
Thank you, Mr. Speaker. Honorable Minister, please, when was the last time you visited this patient at the hospital? And whether you've even visited her before. If so, when? Thank you.
And the question is on measures being taken. What has it got to do with minister's visitation?
Okay. It's part of the minister answered questions on measures, and I want to find out from the minister whether he's ever visited a said patient in his capacity as
So
a health minister.
does it
and if so,
emanate?
when?
Does that question emanate from
The
measures?
minister is very capable of answering this simple
Question overruled.
Come on. Minister, you haven't visited a patient.
Yes. Yes, Honorable Habib.
Mr. Speaker, I want to find out from the minister, as part of the measures he put, is it visiting the patient part of the measures?
Question overruled. The minister clearly indicated in the answer that is under specialist care. Honourable members, we thank the minister for responding to the urgent questions. Before we move to oral questions, let's take a message from His Excellency, the President of the Republic of Ghana. Right Honorable Speaker, absence from Ghana. In accordance with Article 59 of the 1992 Constitution of the Republic of Ghana, I write to formally notify you of my intention to travel outside the country on 1st March 2026 to Arusha, Tanzania, to participate in the 2026 Judicial Year of the African Court on Human and People's Rights, scheduled to take place on Monday, 2nd March 2026. I will return the same day. In my absence, the Vice President, Professor Nana Jane Opoku Ajiman, shall perform my functions in accordance with Article 68 of the Constitution. Honourable members, it appears this message was read on Thursday, so it's captured by the record already. So the record need not capture this. Yes. Yes.
Thank you for, you know that in this narration, it is possible for anyone and everyone to make mistakes.
Yes.
Yes, so even for you to Speaker. Yeah, I was just doing some calculations with reference to the number of times the president has traveled already.
This is not included.
Yes, it's about 31 already. Speaker, already about 31. And Roxy will come and stand here and tell me I do not know mathematics, but it's okay.
Yes.
Speaker, this must not be allowed to stay in the records. I told my brother that his mathematics is wrong.
Is hereby ordered to be expunged from the record.
He wanted it to go as part of the record.
Yes. Honourable members, we We have oral question also scheduled for the Minister for Health. The first oral question stands in the name of Dr. Kinsley Ajimai. Question number 153. Please, you have the floor.
Mr. Speaker, I come under Order 883 and with your leave, an authority from the...
Please ask.
I rise to ask the Minister for Health the plans of the ministry to improve oral health as the 2023 WHO STEP survey revealed the devastating state of oral health in Ghana.
Yes, Honorable Minister.
Mr. Speaker, I'm grateful to the Honorable Member for Abuaka South for the question on the Ministry's plans to improve oral health, particularly in light of the findings of the 2023 WHO STEP survey. The survey points to a worrying oral health situation, including a high prevalence of oral health conditions of over 70%, low utilization of dental services of less than 10%, and poor oral hygiene practices affecting about 50% of the population. In response, the Ministry of Health, working through its agencies, is pursuing strategic interventions to expand access, strengthen prevention, and improve outcomes. Mr. Speaker, it is important to note that a number of dental treatments are already covered under the National Health Insurance Scheme. To further improve the situation, the Ministry has also integrated the health promotion, prevention, and early detection aspect of dental care into the free primary health care program. This is intended to strengthen community education, promote early identification of oral conditions, and ensure timely referral, particularly for underserved populations. Ghana currently has fewer than 500 dentists for a population of over 34 million, with a concentration in urban centers. The Ministry is therefore prioritizing the deployment of more dental professionals to underserved regions and the revamping of the Onuado mobile dental clinics to deliver services to rural and hard-to-reach communities. The Ministry is also leveraging technology to improve outcomes by intensifying the use of digital platforms and mobile applications for oral health promotion. These platforms will support public education on oral hygiene and facilitate remote interaction between patients and oral health professionals, especially where in-person services are limited. Prevention and public education are being strengthened through mass media campaigns to promote regular dental checkups, encourage fluoride use, and support healthier behaviors, including reduced sugar consumption. The school health education program will also be enhanced to instill lifelong oral hygiene habits in children from an early age. In addition, collaboration and system strengthening efforts are being intensified through partnerships with development agencies, the Ghana Dental Association, and the international organization to expand research, funding, and training opportunities. The Ministry will further develop training programs for nurses and physician assistants to provide basic oral health services in remote areas as part of our broader team-based approach to primary healthcare delivery. Mr. Speaker, improving oral health cannot be left to dentists alone. It requires a whole of society effort involving government, policymakers, communities, and traditional leaders, schools and educators, corporate bodies, and the private sector, and individual citizens. Oral health is fundamental to overall health and well-being, and the Ministry remains committed to ensuring that the access to preventive and basic oral health care improves across the country. Thank you, Mr. Speaker.
Honourable Member, any supplementary question?
Thank you, Mr. Speaker. The minister made mention of the fact that some dental treatment is covered under National Health Insurance Scheme. Can you be gracious enough to tell us some of the treatments that are covered under NHIS, please?
Well, you are talking about equipment?
He said under paragraph 3, second line, the minister mentioned that some dental treatment are being covered under National Insurance Scheme,
yes.
National Health Insurance Scheme. And I'm asking, yes, can the minister be gracious enough to let the House know the type of treatment that are being covered
yes,
under
Minister.
NHIS?
Mr. Speaker, I don't have them offered, but within some few minutes I can get it. My officers are just behind me. They will get me the comprehensive list and I will communicate to the House. Thank you.
Thank you, Mr. Speaker. Thank you, Mr. Speaker. Minister is aware that telehealth has been implemented in the country. I just want to know from the minister if dental treatment is part of the rollout of telehealth. In other words, do you have dentists that are doing telehealth in Ghana now? Thank you. Minister, what I'm saying is that you are aware that the telehealth, where doctors will be using telephone to treat patients. And I'm saying that is dental treatment part of the telehealth?
Yes,
and if so,
Honorable Minister.
And if so, can
you ask a simple question so that the minister can understand. Supplementary question doesn't allow you to ask convoluted questions. Okay, so you have posed your question. Let the minister
respond.
Thank you, Mr.
Speaker. I'm guided. Thank you.
Mr. Speaker, the dental care is part of the telemedicine services we deliver in this country. Thank you.
Thank you, Mr. Speaker. May we know how many dental clinics, or specifically the dental clinics that are covered under this scheme?
Please file a specific question.
Thank you, Mr. Speaker.
Yes.
Thank you very much, Mr. Speaker, for the opportunity. Mr. Speaker, in the minister's answer, paragraph 4, with your kind permission, I may read. That the ministry is therefore prioritizing the deployment of more dental professionals to underserved regions and revamping of the Uniado mobile dental clinics to deliver services to rural and hard to reach communities. Minister, I want to find out when the prioritization of the deployment of more professionals to these underserved regions will be concluded. And also,
please, you have asked a question.
Okay.
Minister.
Mr. Speaker, it's ongoing. At the moment, we have prioritized the underserved communities or districts in this country when it comes to deployment of health professionals, because we have seen that the majority of health professionals are overly concentrated in the cities. So it's ongoing. Thank you.
Yes.
Thank you very much once again, Mr. Speaker, for the opportunity. Minister, the revamping of the Uniado mobile dental clinics to communities like my own, when will it be done, please?
But the minister said it is ongoing. So if you want to ask a specific question regarding your constituency, do so.
Mr. Speaker.
Yes.
This one is in relation to my constituency.
Yes. So you can file a specific question. Yes.
Thank you for the opportunity.
Yeah. Honorable Ahmed.
Thank you very much, Mr. Speaker. Mr. Speaker, I've perused some statistics on oral health, and the findings are not the best. Minister, pursuant to your response and what I've captured from the statistics, it says that 84.9% of adults have never received dental care. My question then again is, what are you doing to ensure that oral health care is promoted? How do we ensure that people get sound dental care. 84.9%.
Well, measures to promote.
Mr. Speaker, I believe it has to do with education. I believe that a lot of us do not know how important it is to take our oral hygiene seriously. And, Mr. Speaker, I was amazed to hear from a professional, a medical doctor, that there is a particular, germ that can attack your heart from your mouth if you don't have a very good oral hygiene. And so, Mr. Speaker, I believe that it's partly ignorance, because there are people who take their routine checkups seriously, but they tend to ignore oral hygiene. And so we are going to intensify education on oral hygiene starting from the schools. Thank you.
Yes, Honorable Jerry Ahmed.
Speaker, I do not know if the ministry on its own has started any of these projects, including educating people. And if yes, what's the structure? How do you intend to come to a constituency like my constituency? Because this, I keep getting more revealing statistics, and I'm kind of worried. So,
file a constituency-specific question.
Speaker, I only linked it to my constituency. And I'm kind of worried. So,
file a constituency-specific question.
Speaker, I only linked it to my constituency. But
Honorable
so, Speaker, I can take my constituency out. Because I didn't even mention the name of my constituency as Wejagbawi. So I can take my constituency out for the minister. I know you said that you are engaging. I'm asking what structures you have put in place so that it will be more comprehensive for people to be more engaged.
You are even worsening your case. You are
Speaker,
talking about structures.
Speaker, I'm in your bosom. Speaker, I'm in your bosom.
Please, Minister, you may answer the question.
Mr. Speaker, as I indicated in my response, we are putting together a comprehensive approach to deal with this matter, from the education bit, from the schools through the media, information centers, and what have you. We are also looking at deploying enough professionals to the grounds, and we are also looking at equipping the health facilities to be able to deal with issues of oral hygiene, like increasing the number of dental chairs in our various health facilities. So it's a comprehensive package, Mr. Speaker, we are rolling out, especially with the introduction of the free primary health care. Thank you.
Yes, Honorable Councillor Nyabo.